1 in every 7 people living in the UK was born in another country. They came to the UK from all around the world and for a wide variety of reasons. Most migrants in the UK are young and healthy. However, some have poor health and may not be familiar with healthcare services in the UK. Some migrants, such as refugees and asylum seekers, for example, are known to be more vulnerable and have more complex health needs. Here are the range of factors that can influence the resilience or vulnerability of a migrant, and each can have consequences for a migrant's health. These influences can vary over time as the migrant moves from their country of origin to their destination. Healthcare services in their country of origin may be very different from the NHS. This means some migrants may struggle to understand how the NHS works, where they should go when they have a health need, and who to trust for disinformation. Having to pay for healthcare services or believing they will have to pay can also keep people away from the NHS. In some circumstances, the NHS will charge for some services if individuals are not ordinarily resident in the UK. This may depend on the person's immigration status or the type of healthcare. In this video, we help to explain NHS entitlements for migrants.
I arrived in the UK in 2014 with a student visa. 2 years later, in 2016, I had a child through an emergency cesarean in London. At the time, I had a valid student visa and I wasn't told that I would be charged for the cesarean. 2 months later, I received a letter about a bill of £4,000. Because of the bill, my landlady asked me to leave with my newborn daughter because she didn't want problems with the Home Office. I struggled to find accommodation and I was in between homelessness and temporary lodging at different people's houses for almost a year. My mental health started to deteriorate and I attempted to take my own life. I was so scared of going back to my previous GP because I thought that I would be asked to pay the bill there. I was not able to register with a new GP either because I was constantly asked for a proof of address which I could not provide. Then I found out about Doctors of the World and they helped me. I was able to register with a GP and that is why I'm still alive today. If I hadn't registered, I wouldn't know I had depression and I would have gone ahead with a second attempt to commit suicide. I received some legal advice about the bills. I wrote to the NHS hospital explaining my circumstances and that I'll be paying in small installments. After that, I did not receive any letters about my bills. I applied for asylum in the UK and I was granted refugee status in 2020.
NHS entitlements to primary care in England. Anyone in England can register with a GP practice, see a primary care doctor or nurse, or receive primary care services free of charge, irrespective of their nationality or immigration status. It is not a requirement to provide proof of an address or proof of identity to register at a GP practice, but it is helpful to do so, and patients will be asked to provide documentation if they can. Likewise, there is no requirement to provide proof of immigration. This applies to everyone, including asylum seekers, refugees, people who are homeless or just visiting from overseas. If patients cannot provide any documentation requested, this is not a reason to be refused registration. If homeless, patients can provide a temporary address, which may be a friend's address or a day center, or even the GP practice address may be used. A GP practice cannot refuse to register a patient for reasons that are discriminatory, on the grounds of age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex or sexual orientation. A GP practice may only refuse to register a patient if their list is close to new patients, the patient lives outside the catchment area, or if a patient has been removed from the patient register before. If a GP practice refuses to register a patient, it must notify them in writing of the refusal and the reason for it within 14 days of the decision. NHS entitlements to secondary care in England. The NHS is free at the point of access for individuals who are ordinarily resident in England. People who are not ordinarily resident are charged for the use of secondary care services. However, some migrant groups are exempt from all NHS charges, including non-UK nationals who have temporary leave to remain, refugees and their dependents, asylum seekers and their dependents, some refused asylum seekers, children looked after by a local authority, victims or suspected victims of modern slavery or human trafficking. Some services are always free to everyone, even those who are not ordinarily resident, including accident and emergency services, services provided for the investigation, diagnosis and treatment of suspected infectious diseases like COVID-19, HIV and TB, sexually transmitted infections, family planning services excluding abortions or fertility treatment, services for treatment of physical or mental conditions caused by torture, female genital mutilation, domestic violence, or sexual violence are also free to everyone. Dental treatment for migrants in England. Migrants will be charged for NHS dental services like all other NHS patients. This means dental charges will apply unless the treatment is free for everyone. For example, to remove stitches, to stop bleeding in the mouth, or to repair dentures. However, some people may be entitled to free treatment or help with costs. NHS dental care is free for everyone under the age of 18 or under 19 in full-time education. People receiving certain benefits, or women who are pregnant or had a baby in the last 12 months. A person with low income or no recourse to public funds who is not receiving qualifying benefits can apply for help with the full costs or partial costs of NHS dental care through the NHS Low Income Scheme. Assessing new patients from overseas. It is important to understand a person's previous life experience and circumstances of migration when you consider their health needs. Questioning in this area requires sensitivity. As for any new patient, it may take time for them to trust their healthcare practitioners and feel confident to disclose difficult issues. So it's important that they understand why you're asking them about their personal history, that your questions are not linked to immigration procedures. Everybody has a unique life story that affects their health. As with any patient, getting to know and understand their health needs takes time. Learning about their needs becomes more of a challenge where there are language barriers or cultural differences. To get to know your new migrant patient, you may want to ask some other questions in addition to the typical new patient health check. Examples could include: how long have they been in the UK? Was their migration a positive choice or enforced? Does their current social circumstances affect their physical or mental health? How much social support do they have? How easy are they finding it integrating into UK society? This will provide you with insight into their life experiences prior to migration, such as education, employment, family life, socioeconomic and political circumstances, and previous access to healthcare abroad. This will potentially have a bearing on possible health needs. For example, there will be different health needs for a trafficked migrant or an asylum seeker. and this will also affect how they are integrating into their new community. Some migrants to the UK arrive from a country with a high burden of some infectious diseases. In the UK, most new cases of HIV, tuberculosis, enteric fever, and malaria are diagnosed in people who are born abroad. Some groups of migrants may be economically disadvantaged, live in overcrowded conditions, and live and meet socially with other at-risk groups. This will put them at increased risk of infection whilst living in the UK. For further information, visit the Migrant Health Guide online to find more details about NHS entitlements, health topics, and guidance on assessing migrant patients.